I call the Honourable Mary Ann Street.
Thank you, Mr Speaker. Mr Speaker, this government that came in with such ambition, such aspiration, such promise is turning into a profound disappointment for the people of New Zealand. If there is anything that characterises the second term of this government, it is disappointment. We have children living in poverty. We have 270,000 children living in poverty, and we have a government which has no interest in addressing the causes of the illnesses and diseases which come from poverty, such as housing or wages or jobs, but they proceed with targets that are now becoming meaningless in the health sector. Children living in poverty, Mr Speaker, are 1.4 times at higher risk of dying in childhood than children in higher income households. Children living in poverty are more likely to die of sudden unexpected death in infancy than their peers. They are 3 times more likely to be sick. They are at least 1.5 times more likely to be hospitalised than their peers. They are likely to be hospitalised at 5.6 times higher a rate than those in wealthier areas for injuries from assault, neglect or maltreatment. They are more likely to have poor outcomes in adulthood, including higher risk of heart disease, alcohol and drug addiction, and worse oral health by the time they are 26. Mr Speaker, between 2007 and 2010, the increase in children admitted to hospital with socio-economically sensitive conditions, that is, things that are transferable like infectious skin diseases and respiratory illnesses, were increased by 4,800 admissions per year, 4,800 per year, compared with the 3 years previously. And let's have a look at some of the Māori and Pacific Islands statistics, Mr Speaker. Māori babies are 5 times more likely to die from sudden unexplained death in infancy than New Zealand Pākehā. Māori and Pacifica mothers are more likely to have stillbirths and neonatal deaths compared with New Zealand Pākehā. Pacifica children and young adults from birth to 24 are nearly 50 times more likely than Pākehā children to be admitted to hospital with acute rheumatic fever. Mr Speaker, these are not the statistics of a government that has aspirations or ambition for its people. These are the statistics of a government which is a disappointment. We have a Minister of Illness, not a Minister of Health. We have New Zealanders who are disappointed across the board in the way this government has been performing in the health sector, despite the set-piece song and dance routines that the Minister likes to give in the House. We have people from West Auckland to Porirua who are disappointed that funding for their healthy eating, healthy action programs has been cut, and that they are no longer able to provide those services unless they do it through volunteer labour for those who are most at risk of obesity, of diabetes and of chronic illness. This government is a disappointment to 120,000 type 2 diabetics in the process of changing blood glucose meters. 20,000 type 1 diabetics, and particularly the parents of children of type 1 diabetics, are disappointed in the way the government has handled and proposed and overseen the change to blood glucose meters. There are 500 recipients of the Johnson & Johnson Depuis hip replacement device who are disappointed that there will be no inquiry, as Australia saw fit to do. There are 106 recipients of the Smith & Nephew hip replacement device that are disappointed that there will be no inquiry into that either. The government resists inquiries, resists any examination of anything that might be going wrong in the health system, and in the meantime one gets very disappointed people and health consumers in New Zealand. There are 790 plus pharmacists who are disappointed that they've been bullied into a contract that doesn't have any prices in it post 1st of February next year. That's no way to run a very essential health service in our pharmacies. We have a very disappointed Pacific Island diabetes support worker out in Porirua whom Chris Farfoy knows, who now has to retrain elderly Pacific Island people with diabetes in how to read their new blood glucose meters. And the time that that is taking brought that woman to tears. Mr. Speaker, we have 48% of nurses who are surveyed who said that the pressure they're under at the moment caused them so much moral distress that they wanted to give up nursing. Those people are disappointed. Mr. Speaker, the disappointing legacy of this government's efforts in health is not a brighter future, but a blighted future for the children of the poor.
I call the